Hello and welcome everyone for this session on India Reality Check. Communities speak the truth. Recently, the WHO Global TB Report 2022 was released, and the facts and figures for India weren't very encouraging. In fact, all of us working in TB felt a little discouraged and disillusioned with what we saw, because COVID has done made us go back on progress. But even with COVID, I think we should have been doing a lot better. India now today holds the highest burden of drug sensitive TB, drug resistant TB, and our notifications are very, very low. Government of India has committed to ending TB by 2025, 5 years ahead of everyone else. What we are going to talk today is what is the reality? Can we reach those targets? What would be the implications of such a target that seems almost impossible to achieve? We also see that some states have been declared TB free. What is the ground reality? What are the communities talking about it? So, we have a great panel before us who will bring to us actual realities from the ground. These are people that the Global Coalition of TB Advocates works with on a regular basis. And, uh, um, and we are happy to bring all of them to share their perspectives. And for the first speaker, I would like to invite Ganesh. Ganesh Acharya is a TB survivor. He's a person living with HIV for the past 24 years. He has fought for access for people who need it, and he started engaging with people who are on treatment and supports them on a daily basis. And he interacts with people from the community, people who are on treatment, people with TB, and their families on a daily basis, including drug resistant TB patients. And understands the challenges from the ground of them having access. And he is based in Mumbai, another hot spot for DRTB. So we're very delighted, Ganesh, to have you with us here today. And we look forward to hear what you have to say about India reality from the ground. Thank you. Over to you, Ganesh.
Hello everyone, Ganesh here. Happy to be a part of Community Connect, the Union Conference this year. 20 years ago in India, National TB Control Program revised and reviewed, and in 1992-1993 piloted RNTCP. Last 20 years, I have been working with community. I have been working with program similar way with all stakeholder. The same time, same duration, I had a TB twice. Horrible experience. I had cured TB twice. So, huge challenge. So, my question is why TB is such a huge challenge now in India? Before that challenges and classifying and creating the patent access to quality TB care and communities, community engagement and civil society. So first thing is patent. Last 50 years, we have bedaquiline patented by the Johnson & Johnson, delaminate patented by the Otsuka, and recently Bepol regimen. So we have 53 drugs only that is patented. These patents are the various to access to all. The scale of the regimen of the new drug is a price are not affordable. Bureaucratic, the we know so many some of whom are very young kids who are not getting the new drug, a long and tiring bureaucratic process. And other costs are also too high. That is matter because 3HP, TB-LAMP, CBNAT, cartage, DST, IGRA testing, this is also important. Accessibility, like latent TB management. So we don't have national rollout of the LTBI management because IGRA testing and 3HP access still we don't have. TB-LAMP testing. Access to new drugs to bedaquiline, delaminate, and people regimen. Also DSTB 4-month regimen. Why I'm talking here 4-month DSTB regimen? If I talk here like a challenge, because when I talk today in India, is slow implementation of the scientific evidence. So after 5 years, we will talk. So this is also a huge challenge in India. Out-of-pocket payment like MRI, CT, USG, sodium, potassium, thyroid, ECG, and side effect management of the medicine, management of the comorbidity. So I'm going to talk about access to quality care. The most challenging pediatric TB, pediatric which underdiagnosed, child-friendly regimen limited, even newer drug not registered in India for children. We are a pharmacy of the world. DRTB wards, very limited. Critical care services for the MDR-TB children are very, very huge challenge in India. Stuck out always there, no long-term solution and no even any mechanism to how to resolve the stuck out. Contact tracing is the biggest challenge. Advanced HIV disease also a challenge because advanced HIV disease package, we missing the fluconazole shortage, contrimaxole, pediatric care. And we have a huge challenge in co-infection, TB, HIV, TB, MDR, TB, or HIV together. TB specialist, like when person visit to primary health center or TB hospital, there is no multi-dispensary specialist because the person has to refer to tertiary care because when in terms of TB, managing the other specialists like psychiatric, pediatrician, or neurosurgeon only available in tertiary. The last 40 years, we don't upgraded primary health center. This is also a challenge. And lastly, that risk factor, no specific focus on risk factor because undernourishment, poverty, TB, alcohol use, disorder, smoking, diabetes, and TB. There is no specific focus on that. And lastly, meaningful community engagement and activism, no community-based intervention, no investment on community, no prioritize community in a front, in a central point of the program. So missing activism, divided voice, only invited an or TV day, or last 5 years, 1 or 2 national TV forum happened. That is only how community fit in the agenda of the meeting. So lastly, there is a current huge challenge in how we can resolve. There is a solution also. TB is life-threatening, but TB is curable. Fix the patent law, provide the medicine to everyone. Active action on TB eradication plan, prioritize the quality TB care. Psychological intervention like simple step, appoint lay counselor, mental health, community, peer-to-peer approach. Lastly, invest on TB community. Why I say TB community? The community for community, nothing about us without us, because community is the central point of the TB program. So we have to have that, mindset. So community, don't forget, communities are an expert. And please always remember, community are also a valuable partner. Thank you so much.
Thank you very much, Ganesh, for your very important points that you brought out, challenges, out of pocket expenses, comorbidities, nutrition, and meaningful engagement of the communities. Please do feel free, everyone, those who are attending, to post your questions and we will address them in the discussion time towards the end of the presentations. Next, we have Soumya Gupta. Soumya is a trans community member and she's a trans activist from Mumbai. And in TB, we know that some of the marginalized groups are completely left out of the TB response. So, for us as GCTA, we always try to include those who are marginalized and left out. So, Soumya will bring to us her perspective of TB and inclusion of the community within the TB response as a trans woman. She's very active. She works with the Humsafar Trust, which is the oldest LGBT organization in India. She's also a co founder of many organizations and works with over 2,000 transgenders in Mumbai. And she is very committed to transform trans welfare to make it better and accessible to the trans community. Soumya, we are delighted to have you with us here, and we look forward to hearing what you have to share with us. Thank you, and over to you.
Respected delegation of Union Conference and communities, greetings from India. My name is Soumya. I belong to the Hijra community, working at Humsafar Trust and Feed Foundation, representing here GCTA India. In 2019, total 71% of HIV positive TB patients were registered. During the COVID-19 pandemic, only 39% HIV positive people were enrolled for prevention treatment in 2020. Yes. Approximately half of the patients were not registered for the treatment. If we see the HIV data, only 2% patients know their HIV status. Who are HIV positive means 98% positive people were not aware about their HIV status and TB status until testing. In 2020, during the COVID-19 outbreak, the transgender community faced a lot of issues due to COVID lockdowns, livelihoods were vanished. Moreover, due to COVID protocols, lakhs of transgender sex workers faced stigma and discrimination. Many transgender persons were migrated from suburban to rural areas to reduce the cost of living. This causes loss to follow. In addition, the majority trans population was affected by COVID-19 due to lack of awareness eh, among among post-COVID care and ongoing hormone therapy. Majority still facing health issues, especially breathing issues. To ensure the trans people have to have access to stigma-free component TBK, we need to ensure that all policies count us in and ensure that trans community is an equal participant in policy formation and implementation. Nothing about us without us. Thank you.
Thank you very much, Soumya, for really bringing that the trans exclusion in the whole TB response, highlighting that. I think we need to really do better in ensuring that trans people also become part of the solution and are not just looked at as the problem. And the issue of migration and stigma and discrimination, of course it affects everyone with TB, but I think trans populations experience this even more. So how can we have a equal level playing field for everyone? Thank you very much, Soumya. If there are any questions, please do put them in the Q&A box. We will pick them up at the end of the speakers once they share. So next, we have Prashant. Prashant Sharma is TB HIV activist, and he also represents the Sikkim Drug Users Forum, and he works as an educator, counselor, project manager, and coordinates people around social issues like HIV and AIDS, chemical dependency, viral hepatitis, and along with other health issues as well, and focuses mainly on marginalized population. And we have constantly heard from Prashant what the ground realities are. So when we hear something officially, we also get something from the ground that really reflects the realities on the ground. So, Prashant, thank you very much for being here and sharing with us. Over to you now. Thank you.
Namaste, everyone. Thank you. And I'm Prashant Sharma from Sikkim, India. My deep appreciation to Union for creating the platform Community Connect, where I can share my experience, learning, and also reflect some of the concern of my own country, India, as a TB survivor and also as an activist. Uh, as we know, TB being one of the oldest disease and TB being preventable and curable, still taking lives of so many people. And it is very, very concerning with our current diagnostic, treatment, program, and approach, etc., in this highly, highly advanced time. India, with its ambitious goals of eliminating TB by 2025, really needs to make some steps to change its course to achieve its goal. And what it take India to eliminate TB? Here are some of my views and learning from the ground. Uh, the first is that we still lack the better testing machines at the primary health center, community health center, which connects with a huge number of people from rural and suburban areas. And I think the CBNAT machine should be used as a first line test. And second, in regard to adherence, one of the big challenge and big concern is socio-economic condition, nutrition, stigma, discrimination, mental health. Shorter regimen for MDR-TB is some of the major concern. If we are thinking of, people putting people in treatment with adherence. And my third point is it's time that we need to really invest to empower community, community organization, community intervention to keep our community at the center of the program. Without investing in community, we have various examples from other programs also that will not make an impact. And it is very, very important, and this is very, very high time that we should uh, make sure that the investment happens, especially in community. My last point is a very important point that without community monitoring or community feedback mechanism, we will never achieve the goals that we all are committed for. Community has to be the eyes, ears for these programs. And more importantly, community needs to be the heartbeat of this program. And I think to make an impact, to achieve the goals, that we have to do this few things which is very, very important. And I urge everyone that this is a high time that we should deliver the promises in real, real sense. Thank you so much. Thank you.
Thank you very much, Prashant, for sharing with us. And, communities cannot be left behind in the TB response. And thank you for highlighting that. And the other important point that you raised about community led monitoring, I think, is extremely important. We haven't ventured into that. In a full-fledged manner. But I think communities also need to, lead the monitoring of the program so that we know exactly what is happening at the ground level. Um, so thank you very much for sharing that. Our next speaker is Arti Singh, and she's going to share with us about what do communities actually want? And she represents the TB survivor community called Touch by TB, which is the national coalition of people affected by TB in India. And she's a TB champion working in Delhi, and she works directly on a daily basis with the community members, providing support while they're on treatment, and also other adherence support if needed, and kind of reaches out to get that support for the people on treatment within the local community. So she is actually one of the foot soldiers who is out in the field almost on a daily basis. So I'm going to invite Arti, and uh, she will speak in Hindi, and we will have a translation for that as well. Thank you very much. Arti?
नमस्कार, मेरा नाम आरती है। मैं इंडिया से हूँ एज ए टीवी चैंपियन। आज मैं अपने कुछ पॉइंट्स रखना चाहती हूँ जो इंडिया में जिस चीज के लिए काम होना चाहिए और ये काम नहीं हो रहे हैं। तो वो सारे पॉइंट्स मैं आज आपके सामने रखना चाहती हूँ। जैसे कि सरकार के द्वारा जो टीबी पेशेंट होते हैं उन लोगों को 500 रुपए की राशि दी जाती है जिससे कि उनको न्यूट्रिशन सपोर्ट मिल सके। बट उन लोगों को टाइम से ये पैसे भी नहीं मिल पाते हैं, जिससे कि उन लोगों को जो ये पैसे हैं उन तक नहीं पहुंच पाते हैं टाइम से। तो और जो राशन मैं चाहती हूँ कि जैसे कि 500 रुपए जो होते हैं वो इतनी बड़ी रकम नहीं होती है, तो 500 रुपए भी उन लोगों को टाइम से नहीं मिल पाते हैं। दूसरा जो है, उनको हर महीने जो है सरकार को एक न्यूट्रिशन किट देनी चाहिए जिससे कि उनको थोड़ा सा न्यूट्रिशन सपोर्ट मिल सके। कि सिर्फ मेडिसिन खाने से ही तो बीमारी का अंत नहीं हो जाता ना। बीमारी को खत्म करने के लिए हमारे पेट में खाना होना भी जरूरी है। जब हमारे पेट में खाना होगा तभी हमारी इम्यूनिटी सिस्टम भी बढ़ेगी और हम जल्दी से जल्दी रिकवर होंगे। तो उस चीज के लिए भी सरकार को ध्यान देना चाहिए। उनको टाइम से जो मिलता है सरकार की तरफ से पैसे, वो उनको टाइम टू टाइम मिलना चाहिए। और दूसरा, उनको राशन भी दिया जाना चाहिए इस राशि के साथ साथ। दूसरा जो है, टीबी चैंपियन को भी इंसेंटिव प्रोवाइड करना चाहिए सरकार की तरफ से, जिससे कि उनको भी थोड़ा सा मदद मिले। टीबी चैंपियन जो है उनका भी बहुत मेन रोल है टीबी को हराने में। तो टीबी को हराने के लिए सबका सहयोग चाहिए। तो अगर हम टीबी से सही हुए मरीज को टीबी चैंपियन बनाएंगे, इससे क्या होगा कि उसको भी थोड़ा सा फाइनेंशियली सपोर्ट मिलेगा और वो खुद इंटरेस्ट लेके काम करेगा। और उसको थोड़ा सा बस ये है कि सपोर्ट मिल जाएगा। तो ये सारी चीजें भी यहाँ पर होनी चाहिए ताकि वो आजादी से इस काम को कर सके और अपनी कहानी बता सके कि किस तरह से वो टीबी से लड़के एक टीबी चैंपियन बना है। और उसको भी सारी जानकारी हो जाएगी अगर हम टीबी चैंपियन को और जोड़ते हैं तो, और उनको सपोर्ट करते हैं तो। और मैं एक और पॉइंट ये बोलना चाहूंगी, जैसे कि जो लोग खाने कमाने वाले लोग होते हैं उन लोगों को अगर टीबी हो जाती है, सपोज दैट कोई फादर है और उनको टीबी हो गई, उनके छोटे छोटे बच्चे हैं, फैमिली जो है वो ही चलाते हैं। इससे क्या होता है कि वो मानसिक संतुलन जो होता है उनका खराब हो जाता है। उनके उनके पास ये टेंशन हो जाती है कि मैं अब टीबी हो गई है मुझको, तो मैं अब 6 महीने तक अपना ट्रीटमेंट चलाऊंगा तो काम भी खराब होगा और किस तरीके से मेरा घर और मेरा परिवार चलेगा। तो उनको ये सारी टेंशन होती है। तो इस दौरान हमें ये करना चाहिए कि उन्हें भी घर में छोटा मोटा काम जो होता है वो प्रोवाइड करना चाहिए, जिससे कि उनका ध्यान जो है वो टीवी से हटकर, उस बीमारी से हटकर उनका ध्यान जो है वो अर्निंग में चला जाए और वो मिलकर काम करे अपने घर वालों के साथ मिलके। और उससे उनको ये भी लगेगा कि हाँ, मुझे एक इनकम का सोर्स मिल गया है जिससे कि मेरे को थोड़ी बहुत अर्निंग हो जाएगी। तो उनको थोड़ा सा टेंशन फ्री हो जाएंगे। तो ये चीज भी करनी बहुत जरूरी है। जैसे कि हम उनको दे सकते हैं, एलईडी बल्ब बनाना हो, पापड़ वगैरह बनाने हो, या फिर मशरूम पैकिंग या कुछ पैकिंग वगैरह का सामान का हम उन लोगों से ये छोटा मोटा काम करवा सकते हैं, जो घर में हो सकता है ये सारी चीजें। और लास्ट पॉइंट जो है मेरा, कि हमारा जो सबसे बड़ा मेन मुद्दा जो है, गवर्नमेंट सेक्टर में जो लोग होते हैं, वो लोग टीबी चैंपियन समझते ही नहीं है। वो लोग ये सोचते कि पता नहीं क्या है ये। और उन लोगों को, जैसे हम लोगों को काम करने नहीं दिया जाता ठीक से। अब जैसे हम लोग डाटा मांगने जाते हैं तो हम लोगों को डाटा नहीं दिया जाता है, हमें मना कर दिया जाता है कि आप इस डाटा का क्या करेंगे। अब डाटा का हम क्या करेंगे, हम तो जाते हैं टीबी पेशेंट के घर पे, उनकी हम डिटेल्स लेते हैं, मतलब पूछते हैं कि कैसे चल रहे हैं, मेडिसिन सही से ले रहे हैं या नहीं ले रहे हैं, कोई भी दिक्कत है या कोई भी परेशानी, वो सारी चीजें हम पूछते हैं। लेकिन वो लोग हमें डाटा देने से मना कर देते हैं, तो उस चीज से काफी प्रॉब्लम क्रिएट हो रही है काम करने में। ना तो ये लोग काम करते हैं ना करने देते हैं, तो इसीलिए टीबी चैंपियन को भी लोगों को अच्छी नजर से देखना चाहिए कि ये भी हमारे साथ एक साथ मिलकर काम कर रहे हैं और एक ही कम्युनिटी में काम कर रहे हैं। हम लोग भी टीबी को एंड करना चाहते हैं। टीबी एंड एक जने के बस की तो बात है नहीं कि वो एक कर पाएगा। इसीलिए टीबी को अगर खत्म करना है तो सभी को मिलजुल कर काम करना पड़ेगा। तो यही चाहती हूँ मैं कि सभी को बराबर का दर्जा दिया जाना चाहिए, और सभी मिलजुल कर काम करेंगे, जितना ज्यादा लोग काम करेंगे टीबी के लिए, उतने जल्दी ही टीबी को हम हरा पाएंगे और देश को जिता पाएंगे। सो थैंक यू सो मच।
थैंक यू वेरी मच आरती, आपने बहुत अच्छा बताया. So one of the main things that Aarti talked about, I mean, the slide was in English, but unfortunately there was no provision for having online translation. We have requested that at least this be taken care of in the future conferences, so that more people can join. So one of the things that Aarti talked about was the importance of recognizing TB survivors and TB champions as partners. She said that ending TB is not going to be possible without the TB community, the TB champions on the ground who are working on a daily basis. And I think it's important for everyone to recognize that they also are a very valuable part of the TB response. And in many countries, this is done, but in many countries, this is still a big gap where TB continues to be medicalized, so that people who are, outside of that medicalized sphere are not considered important for the TB response. What we have constantly heard from all the speakers is that we are not where we should have been. Uh, it seems almost a mammoth task, almost impossible for us in India to reach, to eliminate TB by 2025. But we can make a start, we can make a beginning by recognizing people who are TB survivors, TB champions who are working on the ground, by being inclusive of different communities, the marginalized communities, those who are forgotten and left behind, if they can be brought into the response. And like Aarti says, everyone has a role to play in this, and everyone has an equally important role to play. Uh, Stigma is there. We need to create demand. So these are issues that only communities can deal with. So we had a very clear call from all our speakers for better and more meaningful engagement of the community in the TB response. So I'd like to thank everyone who spoke, and would like to open up the floor now for questions or comments. If you would like to share something from your own experience, if you would like to comment on what people have shared, please do comment now. We have some time for us to discuss and share with each other. Thank you very much.
Good day, this is Technical Support. Can the speakers turn on the cameras and microphone for the Q&A? Thank you.
Can the speakers please turn on your videos if possible so that you can mute yourself, but you can turn on your camera so that we can see the speakers while there are some question and answers. I see a lot of appreciation for the speakers. Many want to say that they agree with what the speakers have talked about. We have 25 people who are attending. Please do share with us. If you are from India, do you agree with what has been shared as the reality? Uh, whatever the speakers have talked about, do you agree? Please share with us. And if you are from outside of India, you can also share with us what the reality is in your own country. Please do come in, and you can unmute yourself and speak. Thank you. So there's a question for Soumya. What are the specific steps that you would like the National TB program in India to take to engage the trans community in the fight? What are the specific steps that you would like to see?
The specific uh, hello everyone. Thank you, Blessina, for the question. The specific step is TB prevention program should be given to the community-based organizations. Once once you give the program to community-based organization, they can operate very well, just like HIV prevention programs they are managing. To reach out grassroots level community, we need to involve community-based organization at every step, especially in field. Yeah.
Thank you so much, Soumya, for that. I think it comes back to community ownership, isn't it? Sometimes the program is willing to let you take part in a small piece of the pie. But I think what communities are saying is that we need to be part of the whole picture, whether it is diagnostics, whether it is treatment, whether it is access to drugs, whether
Yes.
it is access to medical attention, whether
Yes.
it is psychosocial support, nutritional support. Communities have to be part of the whole thing. So, for that, I think communities need to be part of policies, because if people who are not communities make policies, they may not play out that well on the community. And I think that has been the struggle. So thank you very much, Soumya, for that. I think meaningful engagement of the community, not in little parts, but the whole picture. We just don't want the door to be opened only a little bit. We want the door to be opened for communities to be part of the response, to take ownership, and also to be able to monitor, lead the monitoring to see how these services are taking place on the ground.
Yes.
Yeah, thank you. I see someone from South Africa, Gwyneth. Sorry to put you on the spot, but if you wouldn't mind, just seeing how is there a difference to what our communities have shared about the what is being told by the program and what actually happens in the ground level? Is there a big gap, or is it more or less the same in South Africa? We'd love to hear from you. I'm not sure if you can hear me from, there's someone from Desmond Tutu TB Center CAB in Cape Town, South Africa. Uh, yeah, this question is for you, if you wouldn't mind sharing. Okay, perhaps not able to hear me. I'm not sure, or she's not there. It would have been interesting to see compare, South Africa and India, because I mean, India has a higher burden, but still, even South Africa, the burden is high. But they have done very good progress with regard to TB. Prashant, perhaps you could come in. I heard that recently Sikkim, your state, the state that you come from, has been declared TB free. Would you like to say something about it? What has caused this declaration? What has Sikkim done that they have reached this position? Thank you. Prashant, can you unmute and come, please? Okay, there's an answer from South Africa. Just before Prashant comes on, I can say that Gwyneth says that it's the same in South Africa also. Their target is to eliminate TB by 2030. Though with the NSP launch next year, um, on TB World TB Day, they will be launching it in 2023. So it's more or less the same in South Africa as well. Thank you very much. Over to you, Prashant.
Yeah. So can you hear me,
Yes,
Blessina?
yes.
Yeah, thank you. So I just like to correct what you have said. Like my state does not basically announce that my state is completely a TB free, but then from the Central TB division, my state was given a bronze medal or some sort of, acclamation that we have achieved in terms of, cutting down the notification rate. But then again, a few days only back, I just all we are trying to show here is to show the truth and the reality of the ground. Few days back, I just heard that one MDR-TB patient has lost her life, basically. So oftentimes I consider, oftentimes I think like, how important my life is to the rest of the world. Is it really the data per se or the number per se? How many people have come? How much we have achieved? But then oftentimes I find like, at times find myself very hopeless too, because the ground is completely different. People are still dying. People don't have still access to a lot of things, whether it is diagnostic, whether it is treatment. And my state being very small and far away from the mainland India, we struggle in so many things. But then, yeah, just because my state being sending few numbers or datas, but then who really comes and sees here? Anybody knows? Anybody has come to the people and have talked to the people? So basically, not. So whatever announcement has made by the CTT or NTEP, I don't care. They are just talking about numbers. We are human beings. We are still dying, and we are not a number. And we want real action. and real action can only be possible if you think that I'm important to the world. Yeah, that's it, Messina. Thanks.
Yeah, awesome. Yeah, we are not numbers. Yeah, whether we live or if we die, then also we become one of those numbers in the death figures. So we don't want to be that. We want to we are real people. Our communities are of real people, and we want people to be treated with respect, to be recognized, and the bottom line is TB can be treated. It is not a death sentence. So I think the more voices come up, the better it will be. And with this renewed commitment of India, I think we can hope that more voices will come up and be able to speak. Thank you, Prashant, for that. I want to actually call on Oksana. Oksana is a very dear partner of GCTA and is from Moldova. So, Oksana, I'd like to give you a few minutes to just share with us about the TB situation with regard to the communities in your country. Oksana, are you able to unmute and share? I'm not sure if attendees can actually speak uh, because we are not hearing anyone. Um, but even if you can type in your answers, we can read. I saw another question. Um, okay. Uh, so, one of the questions to all our panelists who've talked about communities is uh, what are the best ways to engage communities in conversations around TB? Arts, filmmaking, public speaking. What are some of the strategies of engagement that will work best for communities? Maybe Ganesh, if you are on, you can take a minute to answer that, and then we can go to others. Okay, Soumya, would you like to come in?
Yeah, as you said earlier, we need to involve community at every level, from the policy making to the field level. We need to involve every um, every level, and especially using community volunteers, TB survivors, and at the same time we need to involve community in the last to follow up also. Then only we can do the TB free India.
Thank you, Soumya. Prashant, last words before we
Uh,
close the session.
yeah, I think Joe has come up with a very great questions, and I think within the question there is the answer. And I think everything is so important when it comes to TV. Looking at the situation or the time that we are living in, whether it is arts, whether it is filmmaking, whether it is public speaking, even I would rather say even a curriculum at the school level, college level, or at the community level also, this all plays a very very important role. So few days back I was talking with some of my friends that we are trying to set up a one specific place where community, no matter who they are, whether they are from marginalized community or whether they are from general population, can come sit down and not only discuss about TB but then rather discuss about other diseases also. So I think these all things plays a very important role, and oftentimes whenever it comes to TB, then there is a huge stigma, uh, so much attached with the TB. And in my experience, what I have seen is like, rather in the general population, the stigma is much more institutionalized. Often the TV community does not feel very comfortable whenever they go to access the services. So we were just thinking of making some a room where the people can come, sit, relax, talk, express their issues, and together we can take that forward. And Joe, I think whatever the question that you have put in, I think everything, arts, television, filmmaking, speaking, these all things makes a huge impact in, especially in TV response. Thank you so much.
Thank you very much, Prashant, for that. And I think with that, we've come to the end of our time. But I just want to say a big thank you to our speakers who brought out so strongly what is missing and what the reality on the ground is. And I hope we can work together. GCTA is with you. We will continue to work and fight to make sure that the suffering is limited from TB and that our community gets cured and has access to support and drugs and diagnostics. So, thank you very much. And thank you to all our participants, attendees who've joined us for this session. All the best. Let's go and end TB together. Bye bye.
Thank you, everyone. Bye.